Welcome, welcome. Welcome, friends. Today we have Dr. Zeshan with us. He's a psychiatrist and also trained in child and adolescent psychiatry at Harvard University. And today he is going to discuss with us how to take care of ourselves at this time of COVID-19. Welcome, Dr. Zeshan.
Thank you, Dr. Majid. I'm happy to be here, and I know it's a very important and as well as challenging time, both for parents, families, and as well as doctors. So thank you for inviting me.
My pleasure. So is it okay if today, I know you have at least given 2 presentations on the topic. So is it okay if we discuss for self-care, but also at maybe more personal level?
Sure, I think that's a really good way to start.
Awesome. Zishan is my friend. We know each other for maybe 2 decades.
At least, yes.
So I th- so how is coronavirus impacting you?
I think in different ways, I would say, as a frontline clinician, it affects me when I go to the hospital and see so many patients are coming. And it affects me when I am in psychiatric emergency department or in psych outpatient, and patients are coming with a lot of anger, frustration, feeling of insecurity, both financially and socially. And it also affect as a parent. So I have 2 kids, and bringing those exposure, because where I work, that's a main center for COVID for our state. So having those concerns, bringing those things back to the house, and then being, having 2 kids who are not going to daycare. So how to be a father, how to stop my doctor brain, and making sure that having be a good husband at the same time. Yeah, so I think it's impacting many aspects at the same time.
Kudos to you for all the strong work that you do. You're definitely fighting at multiple fronts. And
Thank you.
um, does it cause burnout for you?
Of course, it does, and in a different way. Like there is a lot of stress. Sometimes you just surprise, just a. I remember, so I have, a daughter who one time at the start we heard that one of her friend got positive for COVID. So it was so much stress. What happened? Should I go to work or should I not? And then seeing backward, I think it seems to me that this all stress response, that although it was not that much stressful, we were not sure either that child or that family is positive, but just a fear, just to hear,
Mhm.
causing us to questions, being a parent, either who did, why we sent our kid, why we did that, why we should not have do that. And then as a clinician, thinking, should I go to the hospital? So I think I would say those are all burnout symptoms
Absolutely.
that are coming because of this COVID.
So there is fear, there is guilt, there are questions of what we did, what other people did, and what should we do next. And particularly in your shoes, there are so many choices to make every day.
That's correct.
So how do you do self-care? And I think I'm asking to you, but our goal is other people would use your skills as well. You teach that to others, and I'm sure as you yourself going through telling in your own experience is probably going to give more takeaways for our viewers.
And that's definitely a challenging question. I think I am figuring it out every day, but a couple of things that have been helpful is just to understand that this is a normal response of the body to a very significant stressors.
Mhm.
So that's one thing. Second thing, being a psychiatrist and being trained in infant and little bit on mindfulness, understanding the power of uh, validating someone else's feeling, like if my spouse or if my colleague is struggling, or understanding that if I am struggling, I need to talk about it.
Mhm.
And that person need not to be someone who has mental health training, someone I need to talk about it.
Mhm.
So, and the other thing is that maintaining my routine, understanding that this is a tough time, but the more I stay with my routine, my sleep, my eating habits, my physical activities, and what are my responsibilities, like how to be a good husband, how to make my spouse feeling that she is not burning out. So making them feel important, helping here and there, sometimes cooking, sometimes washing dishes, which I do, but doing a little bit more. And same thing, realizing that when is my day off and I can spend time with kids so that my spouse can have some rest. So those are the couple of things that realizing what are our goals, what are our relationships, and understanding other person with their own perspective. So that what I would say have been helpful to maintain my sanity during this.
In this one response, and you could rewind it and watch it again, every single sentence is a chapter. It's a if Dr. Zishan could give you a lecture on each one of them, because each one sentence is indicative of how much valuable all of those things are. So let's start a little bit, and you emphasize the power of relationships. Many people are spending far more time with their families. And while we used to complain we are not getting enough time with the families,
Mhm.
and now this is a different time. Now, do we even know how to spend that quality time with the families? Is
I think just understanding that uh, family, and I would use more time in the parenting and relationship, is messy. There is no ideal parenting, there is no ideal relationship, and especially during stressful time when everyone is stressed, anxious, sad, um, insecure. So uh, expecting that from someone else in your family or at your work could be at their best, I think it's a little bit hard to ask or expect. So that's one thing.
Mhm.
Second thing is that being understanding about your own body, like what are things that triggers you, what things that make you feel calm and relaxed,
Mhm.
and what things can be done during this time. For example, if I know less sleeping will make me a little bit more angry or irritable, so making sure that I'm having a good sleep and making sure that I'm maintaining that. So understanding triggers and what things can be relaxed, so for your own and also for your family member, your friends. And then more having a mindset of more appreciation, more, we call it a labeled praise. Labeled praise means rather than just saying you are doing good, telling them what they are doing good for, and also making them feel important, and making them feel heard, and making them feel understood. That instead of jumping on conclusion, instead of assuming, or instead of giving the solutions, being take a back step, relax yourself, try to understand, try to validate someone's feeling, and then understand before trying to solve the problem. So those are a couple of suggestions I would suggest.
Awesome. Well, you definitely are a great listener. I would also highlight that listening, same thing for the power of relationships, particularly at this point. There are couples, families who are spending more quality time, and then there are couples who are fighting more. At the same time, on a more serious note, there are more reports of increased domestic violence, for those situations where that was the dynamic has increased now in a more closed space. Same thing for as a parent, those who were losing temper before easily are losing it more or more to the extreme. And these suggestions from Dr. Zeshan are important to help your family. Because if you're losing temper or getting irritable, identifying your triggers, sleep is an important one. And Dr. Zishan, that came up a couple of times. So help our viewers understand more about the sleep, because I don't think people take that very serious.
No, thank you for highlighting that important issue, because that's such a basic human need. And sometimes we have a tendency to sacrifice things that are easier to make us feel that doesn't costing us at front. So sleep is something that we feel, okay, why not let have 2 hours extra today to just watch this show, watch this movie. But in fact, it affects because we have everyone has a clock in their brain. So once you are in the regular schedule, that clock is working, you're going to 10 p.m. is shutting down, and then you're waking up at 5 or 6 a.m. But but now, first of all, there is a pandemic stress that is affecting affecting the parts of the brain which are more in terms of fight and flight response. So that's automatically kind of a default mode. And then on top of that, we are intentionally uh, delaying the sleep because, oh, we don't have work, no is working from home, why not, let's. So it will affect. So how to maintain it? I think first of all, realizing it, that we have to maintain, because this is good for our physical and emotional well-being as well as our relationship. And then making sure that we have almost the same time for dinner, and having the bedtime routine both for the kids, and role modeling for them also, because sometimes we are putting our kids on time, but then we are spending late, and then in the morning kids are awake,
Mhm.
but you are sleeping. So yeah, so I think just realizing it and then having the same, maybe a little bit 1 or 2 hours of delay is fine. We have to give some much flexibility to us, but this is definitely a little bit stress time. There are more responsibilities, but as close as to the normal routine will helpful.
So even if you're not going to work, still stick to your routine. Your brain, your family, your kids will thank you.
Yes, that's what I think. Yeah.
The other thing you mentioned earlier, reaching out to others or talking to people when you are experiencing all of those emotions. So that is very important, social connection and relationships. So do you want to tell us a little bit more about that?
Sure. Um, I think, again, just like I mentioned, that during stress and any kind of stress, the lower part of brain, which you call it amygdala or the brainstem, which in simple way fight and flight, is more active. And
Mhm.
our upper part of the brain, which is responsible for judging, what what is right, what is wrong, is not that much active. So whenever we talk about it, or whenever we tell someone that, I'm feeling sad, so just by labeling your feeling, Dr. Daniel Siegel is a big researcher. He mentioned it as a name it to tame it phenomenon. Like you name your feeling and your upper part of the brain start activating. So that's the one reason that I mentioned, it's important to talk about it. The
Mhm.
second thing is, I have seen in people, especially in healthcare providers and also in some other, that we are good at hiding our emotions, and we feel, and that we can be very resilient, these things doesn't affect, and these things just automatically piling up. And talking about it will help us to understand, maybe just a small thing, what we call it a cognitive distortion, that we were thinking these things are in that way. But just talking about it will help us to clarify, oh, in that situation I responded that way, maybe I would have done this way.
Mhm.
Or discussing with your friend, maybe getting other person's perspective, okay, things may be done that way. And simply it just venting, like, sometimes venting out will help you feel relaxed or calm.
And also, there are certain societies, certain expectations. You mentioned healthcare providers, also from men in general. It is assumed that they should not feel more sadness or emotions,
Hmm.
otherwise, it is somehow considered weak. And same thing for physicians or healthcare providers that if they were to say we are struggling or we are emotionally overloaded, that would be considered they're weak.
That's right. Yeah.
Even if we can't change the situation, talking about it with somebody else would help us process it better. It is more cathartic rather than hiding it, keeping it in. People are not going to work, or they're working in a very different environment, and that in itself causes buildup of tension. So naming it, realizing it, allows yourself to do it. Other person also understands that you are experiencing some emotions, and then you together can make it work it out together.
Yes.
So social connection, sleep, talking about emotions, naming it to taming it, um, and then family connection. Any other key suggestion that you would like to highlight?
Sure. I think one thing I would like to highlight that's key in relationship is jumping on conclusion, assuming things, and solving things without understanding it.
Thank you so much, Dr. Zishan. This was very helpful, and we
Thank
could all use all of these skills, taking care of yourself. And we thank you so much for also talking at a deeper personal level, because many times we psychiatrists are not good at that. We ask questions, but we generally don't talk about same thing like other healthcare providers, that we hide our own feelings. So,
you.
thank
Yeah. Yeah. No, no, thank you so much for inviting, and I really appreciate that.